Okay, my name is Brett. I'm going to be doing my head-to-toe assessment on Sammy. Just at the start, we have our newborn baby here with us that we couldn't find anyone to watch. So if you hear something, it's probably him. So Sammy, I'm Brett. I'm going to be your nurse today.
Hi, Brett.
Hi. I'm just going to do a head-to-toe assessment on you. First, I'm going to start with your cranial nerves. I'm going to ask you a few questions, okay? I'm going to ask you to do some things for me. First cranial nerve number 1, we're going to have you smell something. You can plug one nostril and just tell me what smell this is.
Peppermint.
Okay. And the other one.
Lavender.
Okay, perfect. Curler number 2, we use the smell and eye chart. We've already done that before we started. 3, 4, and 6 have to do with the eye and eye movements. So first of all, I'm just going to ask you to follow my finger. Perfect. Okay, and then we would also do Perla, so I'm going to look at her pupil to see if they react to light. I do a combination also. Okay, perfect. Then I would also do an eye exam, looking for the red reflex, and also looking at the obviousness. So you just stare over his shoulder. Perfect. And this one. Okay. So those are cranial nerves 3, 4, and 6, and the eye exam. Next, I would do 5 and 7. So I can have you puff out your cheeks. Perfect. And then also, I would assess her TMJ. So if I just want you looking closer now. Perfect. Okay, and then smile, frown. We're going to go your forehead for me. Perfect. Then also with that is soft and dull touch, or sharp and dull. So this is going to be dull, and this will be sharp, okay?
Okay.
Can you close your eyes for me and tell me what you feel?
Sharp. Soft. Sharp.
Perfect. So that is 5 and 7. And then 8 is the Weber and Ryan test. So for hearing, I will use the tuning fork. And I'll just have you tell me when you stop hearing this.
Stop.
Okay. When you stop hearing that.
Stop.
Okay. So I do that on both sides of the ear, and that's cranial nerve number 8. And then number 9, 10, and 12 have to do with the tongue and also the mouth. So we'll do some of that. If I just have you stick your tongue out, okay, move it around. Okay, push against my other hand. Perfect. Then if I have you swallow. Okay. And also here, I would just have you say ah, and do the gag reflex. Okay. And while I'm there, I will also just have you open up a minute, look at your mouth and your teeth and your mucous membrane. Everything looks good in there. Okay. And then the last cranial nerve would be 11. I'm going to have you shrug your shoulders. Great. And push your head against your hand. Perfect. Okay. Great. That's the cranial nerves. Sorry. Next, we're going to do rapid alternating hand movements. So I can just have you do this. Perfect. And then nose or finger to nose. Perfect. And then if I can have you stand up and do heel to shin. Great. And then if you just walk out on your toes and come back on your heels. Perfect. And then if I can have you do heel to toe. Great. Perfect. Okay, come on back. Thank you. And then I'll do 2 other things. Graphesthesia and sterenosis. So I'm going to have an object here. If you can close your eyes, I'm going to stick it in your hand and you can tell me what you feel.
Paperclip.
Perfect. And then I'm going to write a number on your hand. Close your eyes again and tell me what number it is.
4.
Beautiful. Okay, so that's all the rapid alternating movements and other tests. So next, I will have you stand up one more time. We're going to check your balance. If you just go ahead and close your eyes. Perfect. And then balance on one foot. Great. And the other. Perfect. Go ahead. Oh, before you start standing, we'll lastly do check for scoliosis. So we just normally have the shirt off for this, but we'll just feel down for any curvatures in the form, which we're good. Okay, go ahead and sit on down. Next, we're going to do the skin, hair, and ears and nose, just the head in general. So we'll assess the skin as we're going throughout the head to toe assessment for any problems, any sores, anything like that. Also the hair, which looks fine. And then we will also do the ears and the nose while we're here. So, working the ears, look at the tympanic membrane and the structure of the ear canal, and also the outside of the ear canal, which everything looks good. We're going to do both sides. Perfect. Okay, and then I'll also have you tip your head back here, look at the nose for any drainage or polyps, any deviation, anything like that. We'll check the nose for it. So that's the head. Set that down. Next, we're going to do the neck, so we'll assess the thyroid and the lymph nodes. So we'll assess the lymph nodes first. Thyroid, how you swallow. Perfect. And then also while we're here, we'll assess the carotid pulses. Okay. And then we'll also listen for a bruit. Over. Everything's fine, so that's good. Next, we will go on to assess the posterior side of the chest, so we'll listen for some lung sounds. And we'll also do CBA 10 minutes, so I'm just going to ask you if this hurts at all.
No.
Okay, perfect. Then we'll just listen to the lungs. Okay, and keep your jacket off. Okay. First, we'll listen to the 7 spots. Okay, and then also going to do some testing, just to have some 99.
99, 99, 99, 99, 99, 99.
And then you can say E for me.
E, 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 E.
And then last one, I'll have you whisper 1, 2, 3. Perfect. So that is listening and the test for the lungs. Next, we will go to the front of the chest. So we will again listen to lung sounds, but we'll also listen to the 5 heart sounds. So I'll just listen to your lungs one more time like that. Okay. And then we'll listen to the 5 heart sounds. So the first one is aortic, which is second intercostal space, right sternal border. Second is pulmonic, which is second intercostal space, left sternal border. Third is third intercostal space, left sternal border. And tricuspid is fourth intercostal space, left sternal border. And mitral is fifth intercostal space, mid-cleavage. Perfect. So that is what we do on the posterior side, or on the anterior side of the chest. Now I'm going to have you lie down, if you could. On your left side, we're going to listen to the heart sounds one more time. Okay, perfect. And then if I could just have you stay lying down, just go to your back. And then here we're going to assess the abdomen. For First I'm going to auscultate, and then we'll percuss and palpate. And while we're here, I also listen for any words through me. And then percuss. Beautiful. Then we'll palpate, so light and deep palpation. Again, do maybe pain response. Where you start with massive. We'll do deep palpation. And lastly, we'll check for any liver or spleen enlargement. So we will, I'll have you take a deep breath. Breathe it out. Great. One more time. Perfect. Looks great. No enlarged spleen or liver. Perfect. Lastly, we'll do extremities, looking for any deformities, also any sort of edema, legs, feet, or hands, which she does not have. We would then do pulses. I already did carotid, so we will do radial. Okay. Also do popliteal. And pedal. Okay. I also check cap refill. Just going to get your hand here. That's good. That's in a few seconds. Lastly, we will do reflexes. I have a little reflex hammer here. So we'll start with the biceps. Just relax your arm there. Perfect. Both sides. Okay, we'll do tricep. Just gonna hold your arm like this. Just relax it. Beautiful. And this side. Perfect. Then we'll do patellar. Dangle your knees a little. Perfect. Beautiful. Perfect. And then while we're here, we'll also do Achilles. Push against your foot here. Great. Great. Okay, and so after all of that, I believe that completes our head-to-toe assessment. That's it. I think.